Okay, so we are already aware of the topic. The subject name is Health and Social Care, and today is our second class. The topic is Understanding of Structural Organization of Chosen Health or Social Care Area. And the key points of today's lectures are types of hospitals in US, what is the organizational structure of a hospital generally, and roles and functions of the staff in the hospital. Before going in detail of today's topic, let us have a recap of previous lecture. So the key points of previous lecture was understanding structural organization, choosing healthcare area, and roles and responsibilities of agencies which are external to the area. In first point, what is the structural organization or understanding about the structural organization? We learned that what were the centralized and decentralized structural organization. What is the main difference between the two? In choosing health and social care area, we learned that there are different care areas or daycare areas or healthcare units in any hospital or any healthcare area. They can be adult healthcare area, neonates healthcare area, children healthcare area, and elderly healthcare area as well. While in roles and responsibilities of agencies, we learned that what type of healthcare services are provided by the external agencies. What were their main roles? They were playing a main role, or you can say they are playing main responsibility in providing comprehensive healthcare services at the time of delivery of services to the patients. For example, if medicines are not available in the hospital, external agencies will help out the hospital in providing medicines to the patients, or the delivery, or they confirm the delivery of medicines or drugs to the patients. Also, external agencies, they help out hospitals in purchasing the drugs and other products. They also help in training of doctors, nurses, and other healthcare professionals. After that, they also influence governments and other bodies. They devise policies. They help governments and other bodies in devising the policies regarding the hospitals and other healthcare areas. They help in improving the working conditions in the hospitals and child care areas, adult care areas, and in short, every kind of care areas. They play a very important role in improving the working conditions. Also, they conduct campaigns that actively encourages the healthcare officials. Among main, or you can say most of the agencies, the few agencies also sets out their strategic priorities and policies. They help government and hospitals in devising the policies, as I have told you earlier. They also play very important role in decision making, or main agencies or external bodies that are on the front line in providing all these facilities are WHO, UNICEF, and many others like this. Okay, let us continue towards today's topic. First point is types of hospitals in US. There are more than 5,000 hospitals in the United States. Patients should look for the right hospital for their needs. What does it mean? It means that if a person or patient is having some pain in his joints, he should consult the hospital in which orthopedic surgeons, orthopedic doctors, or the doctors that deal with bones health, they are present. Okay, if a patient, a female, is going through some gynecological problems, the patient must look for that hospital that deals in only and only that deals with only gynecological issues and obstetrician issues. Okay, so most hospitals provide medical and surgical care for acute, that is short-term illness or conditions. There are two types of illness: acute illness and chronic illness. Acute illness is short-term illness, while chronic illness is a long-term illness. Mostly it is lifelong illness. The chronic illness are lifelong illness. The services available to the patients can differ across the hospital systems and even between the hospitals within the same system. Yes, exactly. Some of the hospitals are specialized hospitals, gynecological hospitals, orthopedics hospitals, ophthalmology hospitals, and sometimes all of these specialists are present within one hospital. All the specialists are there to check the different kind of illness. Hospitals' approaches to the patient's care may differ based on the hospital size, staffing, location, resources, and other factors. Because of these differences, it is important that patients and their caregivers understand which hospitals can offer the specific health care services that they need. Of course, without knowing that what kind of illness they are going through or what kind of disease they are going through, they cannot choose exactly which hospital to be concerned or to be contacted for the purpose. There are different kinds of hospital. Community hospitals, that is non-federal acute care hospitals. Then comes federal government hospitals, non-federal long-term care. Long-term care means these type of hospitals deals with the patients having long-term illness or chronic illness. Non-federal psychiatric care. Okay, mostly psychiatric hospitals or psychiatric ward within a hospital is always present. It is always present, or you can say it is separate part of the hospital, while rest of all the wards are present on one side, while psychiatric care ward or psychiatric ward is present on the other corner or on a separate corner of the hospital, because these type of patients require special care in every point of view, regarding it is mental care, physical care, or isolation, or whatever they need, they are present. They require special kind of care. That is why such wards are present in separate corner of the hospital. Okay, first kind of hospital, that is community hospital or non-federal acute care hospital. So first of all, as the name indicates, acute care hospital mean only the illness with acute illnesses are cured in these hospitals, or the specialist only consult with the patients only consult with the specialist that deals with acute illnesses. Most US hospitals are classified as community hospitals according to the American Hospital Association. Two-thirds are located in large cities. Some community hospitals provide general care, and others focus on certain diseases and conditions such as orthopedics to provide specialty care. We have discussed it earlier that few hospitals only deal with one type of illness, while few hospitals deal with almost every type of illness. They provide general care. A general community hospital might also have areas of concentration or expertise, such as trauma and cancer care, that are often verified by the accreditation organizations like the American College of Surgeons. Community hospitals can have as few as 6 beds or more than 500 beds. Because community beds are non-federal beds, federal government has nothing to do with such hospitals, or you can say these are private hospitals. So they can be as small as 6 bed hospital or as large as 500 bed hospital, because they are financing themselves or with the help of any NGO or any other private organization. So they can be as small as 6 beds. Community hospitals can also be classified as major teaching hospitals, minor teaching hospitals, or non-teaching hospitals. Because they are non-federal hospitals, so they also play an important role in teaching their own staff. Teaching hospitals train future physicians and other healthcare professionals. They also have ongoing research projects or clinical trials and providing care for the patients with rare or complex conditions. So there is too much responsibility on such teaching community hospitals, in which they have to look after the patients, they have to train their physicians and other healthcare professionals, and they're also working on different kind of research projects, and government is not funding them at all. Major teaching hospitals or academic medical centers may be affiliated with the medical school. So the second type of community hospitals are major teaching hospitals, which whose main focus is on teaching their physicians or other healthcare professionals. Usually, they are affiliated with any medical university or a medical school. Third type of community hospitals is non-teaching hospitals. They have professionally trained medical staff and focus on providing essential care for patients in a community rather than medical training and research. Okay, non teaching hospitals are those hospitals which do not play any role in teaching their future physicians. These type of community hospitals only and only focus on providing care to the patients. They do not work on any project, they do not work on training their physicians or teaching any kind of healthcare professional. So usually more good care is usually can be provided to patients in non-teaching community hospitals. Next type, second type of hospitals in US is federal government hospital. As the name says, they are government hospitals. About 200 hospitals are operated by the federal government in the United States. These hospitals provide care for routine medical and surgical problems for specific patient populations, such as active military personnel, the Department of Defense, the Department of Health and Human Services, and the Veterans Health Administration oversee these hospitals. Okay, these kind of hospitals, they deal with only the government employees, who are patients, and the persons who are working there as physicians, they also belong to the government. They are also government physicians, government doctors, and the patients coming over there are also the government employees or the families of the government employees. For example, military personnel, defense ministry, department of defense, department of health and human services. So, but it is not a hard and fast rule that private patients cannot come there and cannot check themselves up by any physician. Physicians will also check the private patients, but they have to pay the fees for them for their checkups. While the government employees and their families, they are entitled persons, so they will not pay the fees. Then is non-federal psychiatric care. More than 400 hospitals exist in the private sector to serve the unique needs of patients with mental health illnesses requiring acute hospital care. These hospitals treat conditions such as severe depression and substance abuse. Okay, so non-federal psychiatric care, they are private psychiatric hospitals. Almost more than 400 hospitals are present in the US to provide psychiatric care to the patients. And they deal with acute hospital care, means short-term illness. Patients are admitted for only short period of time for their treatment, and after that they get discharged. These hospitals treat conditions such as severe depression and substance abuse. So, depression is usually a short term illness, and if properly treated, it can be cured or it can vanish easily. The fourth type of hospitals are non federal long term care. These are also the private hospitals that deal with the patients with chronic illness. For example, sorry, it states that patients with extreme illness that no longer requires acute care are often referred to a long-term care hospitals. These facilities provide medical and rehab care for prolonged periods. Okay, so first the patient will go to any private hospital or any government hospital for his illness or disease, and when the physicians decide that illness is no more short term, or the illness is converted into the chronic illness, the acute illness is converted into the chronic illness, then the patients are referred to non federal long term care, where the patients can be admitted for longer periods of time, or if they get discharged from the hospital, they can continually or monthly they can monthly visit the hospital and take their medicines from that hospital. Because they are chronic patients now, they have to take the medicines lifelong. Okay, second main heading is what is the organizational structure of a hospital, or what is a generally what is the structure of a hospital? Internal structure. Typically, hospitals are set up with a hierarchical and divisional structure. This structure means various levels of staff, ranging from higher to lower level positions, and are responsible for others within their respective divisions. What is meant by hierarchical or the divisional structure? It means that hospital has decentralized organizational structure. Every physician or every staff member has to be responsible for his or her work at his own level. But sometimes main military body or main military officer is usually present. Some hospitals are centralized as well. In those hospitals, the main medical body or the main medical officer is present above all the physicians, just to keep a check on all the physicians or specialists that are dealing with the those are dealing with the hospital patients. So here is a general structure of any hospital. 1,000 bedded government hospital means federal hospitals as well. This is the complete layout of that hospital. Directorate of Medical Education, the main head of the hospital, or you can say this is actually the layout of a centralized hospital. And after the DME or DMO, superintendent comes. Usually, he is non-medical person, but he deals with the medical subordinates and the non-medical subordinates as well. Then comes RMO, resident medical officer. Resident medical officers usually commands, or you can say he looks after the nursing staff, while the superintendent deals with the medical staff and the other non-medical staff as well. Non-medical staff includes administration and support services. Administration includes secretary, purchase officer, office superintendent, UDC, that is upper division clerk, LDC, that is lower division clerk, class 4 employees. They are other kind of employees. For example, they can be janitor, they can be ayas, or some other people like these. While the support services include pharmacy, dietary, biomedical, engineering, laundry, waste disposal, transport, ambulance, and other services. Okay, now comes the RMO, that is resident medical officers. He deals with the nursing staff or paraclinical staff as well as the clinical staff. Nursing staff includes matrons, the senior nurse, then comes the senior sisters, the staff nurses, the probationary nurses that are these are those nurses who are appointed for a specific period, and they are not permanent nurses actually. Auxiliary nurses and DIs or midwives, you can say. The paraclinical staff includes wards and radiology and other services. Wards can be casualty and emergency services, neurosurgery, nephrology, orthopedics, urology, endocrinology, dermatology, STD. STD means sexually transmitted diseases. CSSD, Central Sterile Services Departments, and others. Radiology and other services, plastic and cosmetic surgery, neurology, and psychiatry. I told you earlier that psychiatry and neurology wards, they are present in the separate corner of the hospital. So different and separate kind of care is given to these wards, and special and different kind of services are given to these wards. So actually the whole department is separate from all other wards. Okay, while medical staff includes professors, heads, they are present, they play their role in the hospital as well as in the teaching hospitals, in the teaching section also. Additional professors, assistant professors, lecturers, interns of or house surgeons, and PG students. PG students means postgraduate students. So this is the actual or complete layout of a 1,000 bedded government hospital. A lot of physicians, a number of workers, a number of subordinates, a number of people are actually required when you have 1,000 bedded government hospital, federal hospital actually. Okay, then comes roles and functions of an individual hospitals. If the organizational structure of a hospital is not planned or not coordinated, There can be disastrous and potentially life-threatening consequences. Therefore, hospitals need to have a clearly defined and precise organizational structure to ensure that no mistakes are made during the healthcare provision and administrative process. Of course, in a hospital, critical condition, patients with critical conditions are present, chronic patients are present. Sometimes those patients are present who needs intensive care, or they are present in the separate part of a separate ward of the hospital that is named after such diseases, ITC ward. So if the light electricity is not properly provided to the hospital, or there is no generator or other system and that should be present in case of power failure, then many disastrous things can happen. Maybe a patient loses his life. The person who is on ventilator maybe loses his life if power supply is not present 24/7 in the hospital. So organizational structure has to be very strong, and it should be ensured that no mistakes are made during healthcare provision. Comprehensive and holistic organizational structures can help hospital employees understand their day-to-day responsibilities, facilitate decision making, and revitalize employee performance and productivity. If the organizational structure of the hospital is very organized, every person present on separate level is performing his duty very well, then of course employee performance will be increased, and also the productivity of the hospital will be increased. Second is executive management. After the board of directors comes the executive management. Executives are responsible for successfully performing the hospital's day-to-day managerial decision making, policy making, or policy devising responsibility or role is done by executive management. A hospital executive's organizational role is usually extremely specified depending on which specific function they are responsible for. This includes financial resource allocation, medical executive decision making, and administrative operations. So all of these duties, they are performed by the executive management, and they evaluate their duties, the performance of the staff daily. Daily, the performance is evaluated, daily, the mistakes are highlighted, and they are corrected also so that their performance can be improved. Hospital and departmental administration. Then comes the administration department. Department administrators are responsible for reporting to the hospital executives. We have just gone through what are the board of directors and the executive management. So the administration department has to report to both these bodies. About the specific daily departmental operations of the organization and carrying out the decisions made by the executive management. These includes supervising the provision of emergency healthcare services, overseeing supply and purchase of the necessary medical equipment, monitoring departmental surgical activities, and much more. Administration department, as the name indicates, they are involved in the administration of the hospital. They are involved in the provision of emergency care to the patients. They are involved in looking after the supply and purchase of the necessary equipments. And they are also involved in monitoring the surgical activities, departmental surgical activities. They will report to the higher authorities. Okay. So the executive management will devise the policies, the administration department will look after all these things: purchase, supply, emergency services, or and surgical activities, monitoring surgical activities. Next is patient care service management. Patient care managers are hospital employees that oversee and manage healthcare service providers. Patient care service managers, they are the hospital employees. who look after the service providers. This include creating employees schedules, ensuring that overall healthcare provision process is carried out appropriately, confirming that the hospital complies with the legal regulatory requirements, and addressing patient concerns. So patient care area or patient care service management, they basically look after that whether the services are providing properly to the patient, whether the services are reaching to the patients in their in appropriately or not. They keep a check on the staff, and they also devise or create the schedules of the employees. For example, and they devise a schedule for the janitors in every ward. They ensure the cleanliness of the wards. They ensure uh, the devising sorry they ensure that proper timetable or schedule must be devised for the nursing staffs and for the doctors, and they ensure that every one of them is always available on time for the patient. Next is patient service providers. Patient service providers include all the employees that directly provide medical care to the patients. Okay, so as the name indicates, they are service providers. So it means they are doctors, nurses, and other service providers, which include doctors, nurses, laundry workers, therapists, and more. Patient service providers are responsible for communicating with the patients personally, maintaining individual patient medical records, and ensuring that patients receive the best care possible. Of course, when a person or a patient is admitted to any ward, it means he cannot be cured in outpatient. So that is why he's present, or he's present in the ward. It means that it is prime duty of the physician and the nurses present in the ward to look after him, to ensure that he comes back to the life with full recovery, with full health. So every provider, every service provider, make sure that he will perform his duty very well. Okay, last is the task. Before explaining you the task, please tell me, Abira, is everything clear to you?
Yes, ma'am. It's clear.
Okay, so let us discuss the task, and we will
Okay, ma'am.
continue it in that. Okay,
Okay, ma'am.
your research and materials must cover. You have to do the task. Okay, we have studied, we have discussed all 3 points in these two classes. So I think so it will be very easy for you to do this task. What you have to do is an analysis of the organizational structures within the chosen area, including private and publicly funded provision. Second is an evaluation of the roles and responsibilities of the external agencies who provide advice and influence, for example, government departments, regulatory and professional bodies. And the third point is analysis of the individual function and roles in an organization within your chosen area. We have discussed the first two points in the previous lecture, and in today's lecture, we discussed the third point. What you have to do is you will select any organizational structure with any chosen area. It can be adult health care area, elderly health care area, or children health care area. Then, second thing, you will evaluate the responsibilities, roles, and responsibilities of external care which are present around that area or around that hospital in which you have selected an area. What are they doing? They can be any government department, any professional bodies, almost every external agency that is present around that hospital. You will also write down in detail they what are they doing in providing in facilitating that hospital. And in third point, you have to explain the individual function and roles in organization. Okay, you have to generally write down about the organizations which are present in your chosen area. What are they doing? What are their main roles? So there should be a summary, a detailed summary of you can say the both classes, today's lecture and the previous lecture. But that area should be actually present in your area or whatever you choose. If you face any difficulty in doing this task, you can ask me freely at any time. I will guide you. Okay?
Okay, ma'am. So, ma'am, like it should be a summary, right? Like I have to include all of these points like in different paragraphs.
Yes, exactly. And don't forget to mention
Okay.
all these three parts. Okay? For example, when you are choosing the
Oh,
your desired area, you must write over chosen
mhm.
healthcare area. And after that, evaluation of the roles and
Okay.
responsibilities of external agencies, then you have to write down in bold alphabets that these are the roles and responsibilities of external agencies. You can say it should be on the almost the same format that I have followed. Okay.
Okay, ma'am. Okay, ma'am. Got it.
Okay, what I have told you, I was saying that we have studied about the hospitals that are present in US, but as far as the task is concerned, you have to select the hospital or healthcare area of, sorry, healthcare department of your area. Okay.
Okay, ma'am.
Okay, so what do you think? What will be easy for you? Which healthcare area will you choose? It will be adult healthcare area in any hospital, children, elderly, or daycare?
I I think I'll go with children.
Mostly, I think so. Children care areas or daycare areas are present in everywhere, whether it is in Arab Emirates or any Asian country or US.
Mhm.
Mostly, child care areas are present or elderly care areas are present. Adult care areas are very rare in number. It is hard to find them. Okay, external agency can be any NGO also. If NGOs are present
Okay.
in your area, they can also be included in this second heading. You can add the NGO, the name of the NGO, the responsibilities and the roles that NGO is performing to facilitate the hospitals in its vicinity.
Okay, ma'am.
WHO and UNICEF is of course working worldwide, so they will also be included in the external agencies. And lastly, the individual functions and role of the organizations. Do you have any problem in this layout? Do you want to understand anything?
Um, no, ma'am.
So these are the main four types that are present in US, main four types of hospitals. But I think so these are generally, there are these same types of the hospitals that are present everywhere in every part of the world. I think so. Okay, all right. So you have to submit the task the next class. Yes,
Okay,
it is
ma'am.
11th of October. Okay. So I will
Okay, ma'am.
check your task and I will give it back to you on the second class of this month. That is on 18th October. Okay.
Okay, ma'am. Sure.
So if you find any difficulty, do tell me. Okay.
Okay, ma'am. And ma'am, like should it be written or typed, or it can be either way?
It should be typed. It should be typed.
Okay, ma'am.
I think so that will be
Okay.
easy for you as well, and it will be easy for me to check the typed assignment as well.
Okay, ma'am.
Okay. Okay, Abira. So take good care of yourself and do tell me if you find any difficulty. Okay.
Sure, ma'am. You too. Take care of yourself.
Okay. Thank you so much. Allah Hafiz.
Allah Hafiz, ma'am.